Welcome back to episode 28 with Dr. Clifford Ostrow. Can neurofeedback rewire your brain? I got so much out of that, and I have so many questions. So, like, for example, my kids, I had to fight with my son probably for 2 years just to get him to wear a cap in the wintertime. So do you ever have issues, or how would you manage if you had someone come in for a consult and it's difficult for them to put that cap on their head or wear their glasses? Like, is there a modification or something that could be done differently until they get accustomed to what's needed for the testing?
Right, and that was talking about the coat for your son. My daughter, the same thing. It was January that we started training her, and she would always argue and fight with us to get her jacket on. And then my staff member came and said, "Did you see what Flora did? She put her jacket on. Just being asked once, she didn't fight, she didn't do anything." I was like, okay, well, maybe there is something to this. I modify it. I have the parents, I encourage the parents to bring the children in. And sometimes, they are just so severe that they're not ready for it, is what I tell them.
Mm-hmm.
And I've had one young girl out in Douglasville who, we tried to do a cap on her head, and she's no, and she started just flipping out. And okay, we understand. And I told the parents, I said, I'm here for you. She might not be mature enough for that. And 2 years later, they came back, and she's been doing this for the last 3 years. She's graduating high school. It's amazing seeing her change, but now she comes in once a week as part of her therapy. Mm-hmm. Does she still have issues? Yes, I think we all have issues.
Right.
But it's helped her. Other kids, I tell the parents to go ahead and get like a tight cap, mm-hmm. and just tell them or show it to them. We do use an applicator where we apply gel through the little holes on the cap. Unfortunately, it's done with a syringe that's blunt, which means it's not sharp. And as soon as they see that, they start flipping out. But mm-hmm. when they see me trying to poke myself and it's not piercing my skin, mm-hmm. they understand. And I personally don't have a problem. I think because I have patience. I have more patience from my patients than sometimes my own children.
I can imagine that. And something else you mentioned, so both of my kids have seizure disorders.
Okay.
And I believe they said that it happens in the frontal lobe of the brain. So have you, and I know you mentioned that you've dealt with patients that might have a seizure disorder. So it's possible that this procedure can help decrease that potentially?
Yes, and that was the whole research that like opened up the doors for neurofeedback. We would not use the flashing lights on that device because that can trigger seizures. We never know.
Yep.
But there's so many different types of seizures, and they can happen all over the brain. I've had patients who have had a seizure in the office. They sneezed and had a seizure. And that was pretty scary. But that was an adult actually. But it wasn't because of the therapy. It was just he sneezed. So we never know when somebody can have a seizure. Mm-hmm. But in some cases, we just want to calm the brain, and that's what it is. If you're dealing with traumatic brain injury or a stroke or a seizure, the tissue and the connections in that part of the brain, an MRI will show you, but it doesn't show you diagnostically what's or how it's communicating. And so if there's damage through neuroplastic changes, you can make new connections around that area. And it's really amazing when I've had individuals who had part of their brains taken out and they improved. I mean, it's really amazing. You can Google search videos of neuroplasticity, and they'll show you MRIs before and after and how mm-hmm. the brain accommodates.
I don't think there are a lot of people that are familiar with that term, neuroplasticity. I mean, I got familiar with it maybe like 10 years ago, and I just kind of thought it was a term, but it's really something that happens within the brain.
Yes, it's how we learn. When you're making those connections and those synapses of trillions of neurons communicating with each other. It's really amazing because it's called neuroplasticity, and it's making those connections, and then it's sending it to where it needs to be stored. And so that's why you're able to retrieve how to ride a bike. Now, if you suffered some kind of dysregulated pattern, trauma, well, you might need to work on it to have it come back. But if the damage is very severe, sometimes it might not. It's just hard to say. But, you know, people, musicians who have had strokes, they can learn how to replay the guitar, which is amazing because those connections were there at one time and they are woken up, I guess.
So, is there any medication that is prescribed or any supplements that go along with this programming, or is it strictly through this device?
Through this device, I don't get in. I mean, I could recommend some nutritional supplements, but as far as medications, I can't. I communicate with the parents to monitor behavior, because if you're seeing the behavior change, there's a good chance this is making the change and they don't need the meds. But I can't determine that. So I have them talk to their pediatrician, or if necessary, I talk to the pediatrician and just explain that they're improving. You know, it's up to you to determine if, you know, if the medication is necessary. And a lot of times they come off the medication. But when you see a 7-year-old on 4 or 5 different drugs for attention, sleeping, stomach disorders, it's hard to believe, you know, because that's just setting up problems as they get older.
Right.
So,
right, definitely.
But you know, I'm open to talk. I just don't. I don't introduce supplementation in my office for this.
And how frequently? So, what does like the programming look like? Like, are they coming to your office once a week, twice a week?
Once we do the brain map and they decide to go through the program, it's usually twice a week. Takes about a half hour. We recommend them doing the audiovisual entrainment unit at home prior, possibly in the morning. And then we train for a half hour twice a week. In my office, what I do is I do a brain map every 10 visits, because that will tell me what is the percent change, or I need to stay in the same area, or same protocol, or change the protocol, or move to a different area, because there's so many different things going on with individuals. A lot of times, you know, there's just not one area for one specific thing. It's your brain has to go through that processing, and I find that on that sensory motor strip, a lot of people have processing problems. Information's just not going to where it needs to go. So work on this area first, and then follow through with the protocol to see, you know, how you can key in on that.
And probably one of the biggest questions, because you would know this as an autism dad, is when you have some of these therapies, they're definitely not covered by insurance, right? So this sounds expensive. So what advice would you give to parents, or how do they manage the cost around this? Because, I mean, this is something that I'm thinking to myself, I need to be calling you after this podcast, because it's something I should have done a long time ago. So how do you manage around the cost of it, or does your office offer any support?
Sure. First of all, it's never too late.
Okay.
Okay? Because we do see, my oldest patient was 92 with memory issues. So I've seen usually a mature 5 to an elderly person with different issues. BrainCore Neurofeedback is it has clinics all throughout the United States, but it's owner operated.
Okay.
Okay. So I can charge whatever I decide to charge. The problem I see is that some people charge an exorbitant amount of money for the therapy. I don't agree with that. I do complimentary consults. Some people charge for consults. They charge $500,000 for the brain map. I don't. The first brain map is $250. Because you come in for a consult, you get a $100 discount, so it's $150. Right after that, we go over the report, and 20 visits with 2 free brain maps and the unit is $24.50, and that's over 20 visits and 2 brain maps. So you're looking at maybe 12 weeks of therapy.
Wow.
And then some people are fine with that. That's all they need. Some people need to go further, but that's why in my practice I do a brain map, because that'll tell me how well they're doing, or they need a little bit more work in that area.
I wasn't expecting that.
Yeah. And we also have different programs like Care Credit. We have in-house financing. We try to make it as affordable as possible, but it is an expensive therapy.
So what advice would you give parents of children with autism who are seeking chiropractic or neurological care for their child? Like, where should they start?
With chiropractic care, make sure that they do some research and find a chiropractor that works a lot with children and children's needs. And again, just open up that communication. But we need to also educate the community on nutritional advice. Stay away from the additives, the preservatives, the neurotoxins that are very, very bad for us. Because just by eliminating some of that, you can make a difference. And I know, being an autistic, having an autistic child, that there's a lot of different things that can set people off. Mm-hmm. And it's not treating autism per se, but treating the symptoms of a dysregulated brainwave pattern.
And one more question that I just thought of: TV time, or video time. What is your take on that when going through this therapy? Like, if they're doing a whole lot of TV or video time, should they decrease it for this to be effective?
Absolutely. We used to, for the training, would play video games. Mm-hmm. So we have the option of playing video games and watching movies. But video games these days are using your fingers. And it's very hard to tell an adult or a child, you can't do that. You have to use your brain to hit a ball or throw a baseball at a clown. And I saw that it brought out people's anxiety, because we're so used to doing this. If they come in for the consult, I do talk about things that they can do at home, whether or not they go through the therapy. But one is, even for adults, shutting the games or texting at night. Because what that's doing is it's increasing the beta waves, the focusing, when you should be decreasing it. It's just like at night you want to dim the lights slowly. There are programs that you can set your house lights to, your TVs, and it will slowly dim to put you in that natural rhythm of, okay, I'm now relaxed, now I'm drifting, I'm in theta, and then I go into sleep. And again, if you don't hit that deep sleep, your body can't heal. You're going to trigger headaches. You're going to overthink everything. And adults are just as guilty as doing that.
I was just thinking that. I'm like, at night, I'm laying in the bed and I'm supposed to be going to sleep. And before you know it, I've been on social media for 2 hours.
Right. It's what you're engaging in. So if you're watching TV, you turn away, you go to the bathroom, TV's still going to play. Okay? It's games. It's texting. It's increasing your activity. So watching a movie is not as bad. And the other thing is, you should make sure that there are no lights coming from monitors, computers. Your room should be totally dark. So get a piece of electric tape, anything. Use a mask, an eye mask, because it has to be so dark that it could be that one little thing that's keeping you up, and you're not even realizing it.
Amazing. So I feel like people are going to want to find you after this podcast. So how can people find you? Where are you located again?
I am in Dallas, which is in Paulding County, and also in Douglasville. My number is 770-445-6919 for both locations. If nothing else, call me, talk to me. Maybe I can give you some help over the phone. We are always taking new patients. I've been out in the county. June will be 30 years. And I just love being a part of the community and seeing changes that we can make on individuals and their families.
You're not ready to retire yet? 30 years is a long time.
I'll be 60 and I'm not ready.
You're not ready?
I'm just getting started.
Well, we appreciate your service. We appreciate your knowledge. This has been impactful for me, and I'm probably going to be using that phone number for a consultation. So I thank you for joining me on the podcast. Yeah. And I also thank you for joining me as well on the Real Autism Podcast, where we share relevant, effective, actionable living strategies and solutions. We'll see you next time.